Welcome to Module 4, or Chapter 4, on Bloom's Taxonomy of the MS Testing Online Item Writing Workshop. So at the end of this chapter, we're going to talk about the three domains of learning and be able to rattle those off, as well as list and describe the 6 levels within the cognitive domain. So of the three domains, there's cognitive, psychomotor, and affective. Cognitive is matters of the head or matters of the brain. Those are things typically that is information or information processing that you would then answer on a written test or an essay test. Basically things that don't involve using your muscles other than to write an answer on a sheet of paper. There's the psychomotor domain. The psychomotor domain is the ability to perform skills, such as in the picture here, starting an IV, applying a traction splint, taking a blood pressure, etc. Those are all psychomotor activities. Basically, our brains teaching our muscles how to do something is the psychomotor domain. The third domain is the affective domain. The affective domain, some refer to as bedside manner, but basically it's our professionalism, the way we interact on a personal level with our patients and our peers is the affective domain. Our primary focus in item writing is the cognitive domain. Within that cognitive domain, Bloom has 6 levels within that. And the levels of the cognitive domain that we use are the ones referred to in the National EMS Educator Guideline and the original 6 Bloom levels. You may see references where the last couple of them, or the bottom 2 on this list, are reversed. So let's talk about each of those. The lowest level, not to describe it as worth less, it's just the lowest, is the knowledge level. Kind of think of this one and comprehension as your foundation upon which you will build the rest of your information. So the knowledge level itself is the ability to basically regurgitate information. So to list and or define, identify, those would all be knowledge level type verbs. Basically, what's the definition of this? And when they can pull it word for word from whatever or provide it to us word for word, that's knowledge. The next level up is taking that knowledge and making it more your own. So you basically comprehend the information. So for example, in knowledge, shock might be inadequate tissue perfusion. Whereas to describe that you understand shock or comprehend it would be to say the shock is where cells aren't getting what they need or getting rid of what they need to get rid of. Application and analysis are the next 2 levels in order. Basically, those are the ability to apply and or look at the facts straightforwardly and analyze that information and tag it. So basically, this is what most of your entry-level people would be at. This is what most of the test questions should either be here or a little lower, but this is where the bulk of the test questions should be at the application analysis level. Usually you differentiate knowledge and comprehension. They become application and analysis when you set up a straightforward scenario or situation and ask the student to provide an answer. The final 2 are synthesis and evaluation level. These are often referred to as the problem-solving level of Bloom's taxonomy. So in these 2 cases, things become much more challenging, hence the reason problem-solving. In synthesis, the student is asked to think outside the box. They're basically provided a scenario that normally would have a pat answer, a regurgitated or application level answer. But in this case, you've also added a variable that isn't necessarily included within normalcy. For example, what would happen to a patient who is involved in a significant traumatic experience, who also takes a blood thinner, or who also takes a beta blocker, who also takes a calcium channel blocker? So how will those interfere with the normal response that one would expect at an application analysis level? You just added a variable that probably is not described in any textbook or protocol. So they have to think it through and solve this problem. Finally, the evaluation level is being able to defend your answer, and not defend your answer because it's found on page 7, because then if it's just someplace that could be regurgitated, then it would be knowledge. But to defend your answer based on principles, based on thought processes, based on synthesis, analysis, application, all those levels below. That would be the evaluation level of the cognitive domain. Very, very difficult to write a question at that level. Typically, when you write a question at that level, all of the answers are correct. One is just more correct because of certain principles, or all of them are correct, but what would be the most important, or the thing you should do first, would be an evaluation level type question. So again, there are the 3 domains: cognitive, matters of the head; psychomotor, matters of the hands; and affective, matters of the heart, bedside manner. And the cognitive levels, there are 6: knowledge, comprehension, application, analysis, synthesis, and evaluation. Hope you've enjoyed this chapter. I'll take a pause and then move on to chapter 5, which will involve objectives and identifying their parts. Again, any suggestions you may have, we would love to hear. Otherwise, we look forward to seeing you in Module 5. Thank you.